Now, can we prevent diabetes? Because that will be essentially a very important issue with all the prevalence of obesity and pre-diabetes. So there was this old study that was done in China, the Qing IGT study, in which clearly diet, exercise, and a combination of diet and exercise decreased the incidence of diabetes. This was 6 years, from the control population in which almost 70% of the patient developed diabetes to about 40%. So diet and exercise is powerful. In the US, a similar study was the diabetes prevention program, in which almost 5,000 patients with pre-diabetes, impaired glucose tolerance, they were randomized to either placebo, lifestyle changes, which was basically a goal weight loss of 7% and a goal exercise of 30 minutes per day, 5 days a week, and metformin. And as you can see, after the 4 years, lifestyle changes decreased the risk of diabetes by 60% and metformin by about 40%. Now, if you look at the different population, what I found it very interesting, if you look at patients that were younger, 25 to 44 years of age, metformin and lifestyle changes were similarly effective, and placebo was clearly not very effective. If you look at patients that were above age 60, then metformin was almost the same as placebo, was lifestyle was effective. So in elderly patients, exercise is much more powerful than medication. And if you look instead at the BMI, so the body mass index, patients that were more obese, then again, metformin and lifestyle were very effective, but the patients that were less obese, metformin was not as powerful. It was actually almost indistinguishable from placebo. There have been other studies with other drugs. Acarbose had been studied and showed a decreased incidence of diabetes. Thiazolidine, rosiglitazone was also studied in the past and showed it improved, decrease the prevalence of diabetes, but clearly lifestyle changes are still the most powerful to prevent diabetes. And we can say that about 70% of type 2 diabetes could be prevented by a healthy diet and physical activity, which will be translated worldwide in a humongous changes in terms of prevention.